Well, this is a real exciting meeting here. We're going to admit a few people into the meeting. This is a Zoom meeting on the topic of homelessness and social services in the wake of COVID-19. So for those arriving, thank you very much for joining via Zoom. We'll let people in here, and as people arrive to the meeting, we'll go ahead and just welcome them. It looks like Jared is go ahead, and he looks like he's putting up a few things onto the screen. So thank you very much. I want to introduce Jared Wiegand. He's offered to help with some of the administrative background on this call.
Hello, everybody.
Again, for those joining, this is a Zoom call on the topic of homelessness and social services facing COVID-19. And to kick things off, I'm very delighted to know that we have our assemblyman here, one of our two assemblymen here in Monterey County, and that's Robert Rivas. So I will go ahead and unmute him. I know he's in between meetings, and it just means a lot that he's in Sacramento fighting the good fight. And to kick this off, I just want to introduce Assembly Member Robert Rivas for a couple of words. So whenever you're ready, Assemblyman.
Hey, Steve, can you hear me okay?
Yeah, I sure can.
Fantastic, man. Hey, I really appreciate you giving me the opportunity and inviting me to be on this call. And so certainly, I just happened to catch your words of me being in Sacramento. So that's the frustrating part is certainly I haven't been in Sacramento as we've been, on recess, through this crisis. I just got off the phone with my colleague and good friend, Senator Ana Caballero. But certainly, again, Steve, really appreciate your leadership. And certainly this has been, a challenging time. And just to give you, some insight is, as far as what our state is doing, has done, where we need to go, is certainly, this process has been challenging because the impact of this crisis, this is a global issue. This is, a pandemic that none of us have ever experienced. And I say that because the pain is not just deep, but it is very, very wide. This pandemic, this virus has impacted each and every one of us, the quality of our lives, the way we live and interact with one another, and certainly the way we work. And I know, Steve, you had mentioned to me, to give a message of inspiration, which could be, very challenging under these circumstances. But, if there's any inspirational message I can give is the fact that we're going to get through this. This pandemic, this crisis, obviously hasn't been easy. But how we come out of this, how we recover from this pandemic, and really the subsequent economic toll and fallout that we're going to experience in this state, especially in our region, an agricultural region where ag is really the lifeblood of our regional economy. It's going to require the work from each and every one of us, within our communities, at the local level, the county level, and certainly the state, federal government. And I know for, our state, our response, what has been challenging and been frustrating to an extent is that, the response from our state government has been managed by executive order, has been managed by the governor. You have a legislature that's been historic, under this historic recess. And so we're eager, I know I'm eager to get back to work. We're scheduled to return May 4th. And, I know myself, my colleagues, as I mentioned, I just spoke to Anna, we're eager to, get back for two important reasons. One is to ensure that we're providing oversight of the executive branch, especially a lot of the expenditures that have been made recently out of the governor's office, to certainly make sense and or expanding on all of the actions through these executive orders the governor has signed. Because if it's anything, I have realized, in the better part of this month, is certainly appreciate the governor's leadership, but certainly we have to do everything we can as a state to not leave any region, any part of the state behind. And the call that we had with the governor last week certainly emphasized that point in mentioning that very little has been done for a region such as ours, where our economy is so dependent on agriculture.
Right.
when you see the governor signing an executive order, rolling out programs to prioritize housing on a temporary basis, procuring hotel rooms for frontline healthcare workers, which is, very understandable and very much needed. But certainly our region, we deserve the same, efforts and the consideration to ensure that we are being prioritized where agricultural workers, farm workers, that are, this essential industry that is ensuring that we have food stocked in the grocery stores and that we have the ability to have fresh produce in our homes. We should have, the industry should have the opportunity to, be able to house their workers on a temporary basis so they can shelter in place, they can quarantine. That way we are doing everything we can to prevent an outbreak, because if we experience an outbreak, then that really is going to jeopardize, ag productivity, and certainly hurt, our region. But then certainly ready to get back to work to respond as a state to this crisis. Both the economic toll and the fallout of this pandemic is extensive. It's going to be severe. Economists have predicted that the economy is going to shrink by 11%. And we haven't seen that type of contraction since the Great Depression. And so that should concern us all. And the conversation we had with the governor last week, he told us that when we get back to Sacramento, when we see the 3-year projections, that they're going to make our jaws drop, meaning the 3-year projections for our budget. He anticipates our unemployment here in the state could reach 25%. And we are a state that's going to experience massive revenue losses. And this is certainly a huge problem. The governor's also alluded to this new normal, that once we get, off of this shelter in place, these orders, how quickly can we recover? And that's been the frustrating part, is really looking to what the federal government has done. Certainly appreciate what they have done. But certainly you can see in all of the stimulus that has been passed, it hasn't been enough. It hasn't been enough for small businesses. It hasn't been enough for workers that have been laid off. And certainly when you see what other countries are doing, the response how they're responding to this crisis, ensuring that small businesses are protected, paying small businesses to retain workers. They're trying to freeze their economies, so that way when the shelter in place orders are lifted, they can get right back to work. You don't have the pain of having to file unemployment, having to hopefully get your job back, or having to apply for another job. So how we respond to this crisis individually as communities, as I mentioned, is going to take each and every one of us. How safe do we feel going out in public and interacting with other people, and certainly going to the grocery store and trying to live like we used to live. It's going to take time, and certainly how we, our governor laid out his 6 criteria for how we can unlock the state and get back to a normal. But certainly the one criteria that I think is the most important is we really have to ramp up testing. And certainly in a region like ours that is rural, we have to ensure that testing is prioritized for our essential ag workers, for our essential ag industry. But also we have to ramp up testing so that way we know who's carrying the virus, and ensuring that we are protecting, all parts of this state and of, our communities, and certainly those that are most at risk to be impacted by this virus.
Yeah.
I'd be happy to answer any of your questions. You have questions for me, Steve, but really appreciate the opportunity, and certainly excited to get back to work to Sacramento, and certainly I just encourage everybody to visit. We have a very interactive website with real-time updates to this crisis, as far as resources that are available to cities, counties, to our communities, to residents. My staff is always open, always available. People have questions, they can call our district office line in Salinas, our capital office in Sacramento, and any information that we can provide, any way we can help people, we certainly will.
Well, thank you very much, Assemblyman. Again, for those joining, this is a discussion on homelessness and social services facing COVID-19. That's Assemblyman Robert Rivas. He's done a terrific job representing us, and I know this is an area of concern. I know you're in between meetings, Assemblyman, so We have your aide, Dominic Dursa, on the call. I really appreciate that. And I'll make sure you get a transcript of this call. And with that, just a quick word or two on the format. We'll continue on here. We'll go through some introductions, and in those introductions, a brief word or two, the various people in attendance as to the organizations they represent, and then we'll go ahead and move on to you don't need to share the screen, Jared. That's okay. Thank you. We'll go on past the introductions, and then we'll do some Q&A. So with that, I thought if it's all right, I might introduce Teresa Erickson. Teresa's done a terrific job with Community Homeless Solutions. Teresa, if you want to just give a bit of an introduction to yourself and some of the role that you have in addressing homelessness and certainly social services.
Hi, Steve. Thank you so much. So I'm the board chair, and I've been on the board for 8-9 years now, a long time. Anyway, I've been the board chair for the last 5. So we're actually, because of the shelter, we're highly involved with things that have changed with our shelters, because some of them were just overnight, as you well know, and we had to move on with those. So I've been highly involved. I'm also a healthcare professional. So I've been dealing with a lot of the homeless issues and the policies and procedures, I guess, related to COVID-19, so that we're following those safety procedures too. So that's kind of a little bit of introduction to me.
Great. Well, we'll definitely get back to you, and I know I have some questions as part of the discussion today. And then I also see Robin McCrae there. I actually sit on Robin's board. She's got over 25 years experience running community human services, also an important social service provider, and addressing homelessness. Maybe just a bit of an introduction there, Robin, and anything you're observing, if that will work. Let me go ahead. Yeah, you go ahead.
Certainly, Steve. I'm happy to be here tonight. I really want to thank you for calling this important meeting. It's great to get everybody together and to hear everybody's perspective about what's going on. And I just appreciate this opportunity. So I've been with Community Human Services, as you said, for a long time, since 1992, actually. But I was also born and raised in Salinas, which a lot of people don't necessarily know about me. So I love this community. I spent all my years here except for the 6 years that I was in college. And it's really sad to see not only what's happening across the country, but how it's affected our community here locally. Community Human Services provides a lot of essential health services, both mental health, substance abuse, and homeless services. And so I think it's important that we continue to be on the front line and keep our services going, and do what we can to help people as they're making their way through this new landscape with COVID-19. It's affecting people in a lot of different ways and really having some harsh impacts on people's lives. So whatever Community Human Services can do to help the community, that's what we're here for.
Well, thank you. And, we had a board meeting last week, and Robin was very, you've handled things remarkably, as I know Community Homeless Solutions has as well. The need for service doesn't go away. So I look forward to continuing this dialogue. I also want to take a minute to transition to Pastor Artis Smith. I know he's on the call as well. He's pastor at New Hope Church in Salinas, and you've been very active in the church community and the efforts, in Salinas and on the peninsula as it relates to homelessness. Pastor, maybe a bit of an introduction to your ministry and what you're involved in.
Thank you, Steve. As Steve said, we have been intricately involved in feeding the homeless over the last, several years, and, not only in Salinas but also on the peninsula. And just because COVID-19 has started doesn't mean the need for reaching out to those who are less fortunate than us have gone away. Actually, it's really increased, and with the shelter in places, and most of our churches that are really shut down 100%. And along with the Ministerial Alliance in Monterey, and also the arm in Salinas, we're feeding almost 500 people, a week at each per feeding. And so starting Tuesday, we're going to start feeding at least 100 people, on Tuesday, and see how that expands out maybe to Saturday and also Thursday, depending on the resources that we get. But people are in desperate need. And along with that, with hygiene bags for the homeless, I'm sure Robin can speak to that. Also, Teresa, we minister to a lot of homeless people who just don't have the basic necessities. Toothbrush and toothpaste and soap and just combs and stuff like that. And so one of the things our ministry does is that we hand out what we call hygiene bags, and that's ramped up. And so we'll be talking more about that, and hopefully we can get some resources to help us continue that ministry.
Well, that's appreciated. And the idea for hygiene bags and what can be assembled by volunteers and then delivered. These are some of the ideas that have come up, and I'm sure we'll talk about them more. I am taking notes. There'll be some takeaways from tonight, and I will send those out. Thank you. I'll move on to our next speaker today, and that is City Councilwoman Gloria De La Rosa. She's been on City Council and involved in city government a long time, and she's been in the trenches. She not only served the county as a public health nurse, but has been very active, on the ground, whether it's in Chinatown or in the encampments. And Councilwoman De La Rosa, if you could offer a bit of an introduction, that'd be great.
Everyone, can you hear me?
Yeah.
Hello?
Yep.
Can hear
You're coming in clear.
Okay. Yes. Well, I have to thank our outreach team that we established with the city of Salinas, and I really want to give a shout out to community development, Megan, her staff, and especially Councilmember McShane, and to the audience that's hearing me, is to our leaders, our community leaders in the encampments. And I want to give a shout out to Pam Weston, Rita Acosta, and especially our residents. I call them residents, and they live in our encampments. And what I took it really to heart to volunteer. A lot of you know I'm a retired nurse from the Monterey County Health Department. I did public health for 40 years. So my husband and I are volunteering with the Salvation Army every day, and I have other volunteers, friends of mine, that we are going out to the encampments, and we're engaging with the residents of each encampment, and we're taking them sack lunches, and we're asking them, doing kind of like a mini assessment. Is anybody sick? What do you need? Working with them. But the most important thing is the engagement with them. And like I said, the Salvation Army, thank you for all the volunteers that are preparing those sack lunches. We're giving out like 300 to 350 lunches today we gave out in the different encampments that are within our city. And there's quite a few. Some of them are large, like 50, 70 in Industrial Park over there by Sanborn, Rossi Rico, Casentini. We're coming over here to Natividad, over here by Natividad Hospital in the Safeway area. Yeah, we're going out there to take sack lunches to some of the residents from that area. But again, the city of Salinas has been really proactive. We put those 20 hand washing stations, bathrooms. They're being monitored by our leaders to make sure that the water is running, that the bathrooms are working, that they're clean, and just trying to work with the residents for sanitation purposes, picking up trash, so forth. Really working with them. And like I said, the most important thing of all this is connecting with them, having that community engagement with them, that, we care. And like I said, every time we go to an encampment, we're asking, is anyone sick? Is anyone coughing? Does anybody have a fever? And we're being told that everybody's fine right now.
Wow.
So that's good. Yeah,
Yeah.
but again, we go back to testing. We don't know, the testing is critical. I'm gonna thank Assemblymember Rivas for being very supportive of that, because yeah, the testing. People are asking the community members, where can we get a test? Well, to get a test, you have to be symptomatic right now, from what I understand. And the county is not going to do a test. Okay, you have to be symptomatic. And if you go to Memorial Hospital, same thing, and Natividad and Chomp. So the private sector, there's some people that are doing the test, but I cannot give you very much information on that. I have not been tested myself.
Yeah.
I would like to be tested, but anyway, that's the county, and we need to hear more from them. But going back to the city, Councilmember McShane, we're doing a lot of good things, and we're trying to keep Chinatown clean and working with the residents of Chinatown. And I really want to thank the providers that have been giving, services. I want to thank Jill Allen and others that are providing services to our homeless population, my residents out there. Thank you so much. But yeah, it's a team, and we need to really, work together on this.
Yeah, thank you, Councilwoman. We'll come back around. We'll have a few questions for follow-up. And I think you mentioned, the hand washing, the hygiene, working
Yes,
together.
that is important.
Yeah,
and
thank you.
wearing a mask and wearing gloves, and don't be around sick people. If somebody comes to, if you have contact with somebody, I always tell people, I ask them, are you sick? If I hear a cough or something, or is somebody sick? Yeah. So again, the social distancing, the hand washing, all, know the symptoms, and we need to stay sheltered in place, and we need to take care of ourselves.
Well, one thing I'll mention as a takeaway that we're working on, Councilwoman De La Rosa and myself, and that is to get regular trash pickup amongst the encampments. So that'll be a definite takeaway. And with that, I want to transition into Jill Allen. She is with us. She has been with Dorothy's Place a long time, and she's on the front lines on Soledad Street. And Jill, if you could, maybe I think Jared's going to unmute you there, and maybe we can just have you say a few words and a bit of an introduction there on behalf of the Franciscan workers in Dorothy's Place.
Have those boundaries set. She, on the other hand, has been very inappropriate, and what she's done to you is basically sexual harassment.
And I realized that.
I think we got Jill there. Maybe we'll
Hang
come
on.
back to Jill. She might be with a client, and that's okay, because I think, I'm not sure if Roxanne is with us from the Homeless Coalition. I don't think she is. Or is Reyes with us, Teresa? Do you know? I'm not sure if he was going to be able.
Reyes is not. And for those of you who don't know, Reyes is actually resigned from his position and is working back as consultant part-time. But Rodrigo Torres is our interim director, and then we're kind of I'm providing support also to that position.
So Steve, you kind of caught me at a moment there, but I'm back
here.
with you, and I see that there is somebody from the Homeless Coalition here. I don't know where they're, how they're dialing in, but I can see it on the screen.
Okay, they raised their hand as well. So Jill, go ahead and do your intro, and then we'll go to the Homeless Coalition. Yeah.
Okay, so hi everybody, I'm Jill Allen. I'm the executive director at Dorothy's Place in Salinas. And our struggle through this, this viral attack is to continue providing the services that we provide every day. Our specialty is working with people that are chronically unsheltered, and most of these people are adults. There are a very small percentage of youth and an even smaller percentage of actual, younger children that we try to get out of the Chinatown environment just as soon as we can. We serve approximately 180 people in the Chinatown encampment, which is our county's largest encampment still, I believe. And we also serve right around 1,200 other people that seek us out in Chinatown for services. We're privileged to be able to continue to serve meals, hot meals, breakfast and lunch every day, but our consumption has gone up by 34%. We are just terribly grateful for all the volunteers that have chipped in to help us out, because right before shelter in place went into effect, our volunteers figured out that Chinatown was not a particularly safe place to be during COVID-19. So they excused themselves from working at Dorothy's, which basically cut our manpower by 25%. But due to Community Foundation and Bank of America Foundation, we've received enough COVID relief funding to hire some temporary employees. These are people that have lost their jobs through this pandemic, and we're very grateful to be able to continue what they did before, which was caring for other people. And so we've got 8 new temp employees on staff for a couple of months that are basically helping us carry on and do what we do, which is feeding people through mass meals, providing basic necessities such as restroom, shower, laundry, mail, things like that, providing contact with community health workers so that they can be assessed and placed into a group of people that are waiting for a social worker to work one-on-one with them to get into housing. And then, of course, those social workers. And lastly, we have a 24-unit transitional residence in 2 different locations in Salinas that we are accepting at this point in time only referrals from the county master list that is managed by the coalition.
Wow. Okay. What a great overview. And I know we'll dig in a little bit deeper as to needs and such. Was there anything else that I may have forgotten, Jill, or you may have?
Our needs basically through this particular point in time, and by the way, our needs will escalate as the chronically unsheltered population becomes more sick with the virus. But our needs basically surround supplies and funding employees that are filling positions that used to be filled by volunteers.
Wow.
We do have some volunteers joining us from Salinas Valley Memorial Hospital. They have a pool of employees that are not productively employed at this time, and they're sending them out into the community to volunteer for organizations that need volunteers. So we're very blessed to have them. But right now, at least, they're in fairly small numbers. So if there's anybody out there that is willing to come to Chinatown to volunteer, or willing to take on an assignment that doesn't mean you have to come to Dorothy's Place at all, we'd love to hear from them.
Got it. Okay. Well, thank you for that overview. And as we transition through some of the Q&A to the agencies, focusing on needs are going to be very important. I want to go to the Homeless Coalition, if that's possible. If Jared, you could unmute them. I didn't know who was here on behalf of the Homeless Coalition, so that would be great. Just a bit of an introduction. That'd be helpful.
Hi, this is Roxanne Wilson. I am the Executive Officer of the Coalition of Homeless Services Providers. Thank you for having me. The coalition serves as what's called the Continuum of Care Coordinating Agency, and our main responsibility is coordinating services in Monterey and San Benito County, driving funding to our partner organizations, and also writing policies, implementing policies. We also are the main point of contact for coordinated entry, as Jill mentioned earlier, and we are currently serving in a capacity where we're trying to get as many resources to our partners as possible. Today, for example, I've been able to negotiate some face shields from a private donor, and I think that we're getting a little bit less than 100. We've been working with the county to get hand sanitizer and masks and get that distributed. And also, we have now become the point of contact for various restaurants who are trying to donate food. So tomorrow we'll do our first drop off to one of the encampments in Seaside. And we are also getting food to Interim this week. We've gotten food to Victory Mission, and I have my entire staff working on just contacting everybody that we could think of, seeing how they can help get these resources to the service provider network. Most recently, we were able to access like $500,000 from the state, in which we have distributed to the county's EOC, so they can get the motel room stood up and also do anything. And the money's also to support anything else that the EOC finds as a priority. I know that money for the county right now is really unavailable. So in any capacity that we could help get these projects stood up, we're actively looking for resources for it.
Got it.
If you don't mind me piping in for just
Well, what a
another
great
second.
introduction. Thank you very much. Yep. Oh, yep.
You know, you asked what we needed, but I should probably also offer what we can provide. So we are actually at a kitchen capacity right now where we could be preparing meals that could be delivered into encampments or provided to any sort of sheltering organization that is requiring meals. It would just basically take an email to me or info@dorothysplace.org. But since we have developed this capacity, I should offer it, especially during this call, to other providers that might have a need for meals.
Very helpful. I wanted to go to Pastor Harold Lusk. He is with Bethel Missionary Baptist Church in Seaside, addressing homeless and social service issues. So Pastor Lusk, if I could introduce you for a moment.
Good evening or evening, everyone. Pastor Lusk, Bethel Missionary Baptist Church in Seaside, California. Thank you, Steve, for inviting me to be on this call. And again, hello to everyone. We, Bethel Baptist Church, before the whole COVID-19 took place, we were providing through the Monterey Food Bank food bags on Tuesdays and Thursdays during our food pantry. And then we began to have a hot meal every Thursday for the homeless specifically. Also specifically for the homeless, we are partnering with Orphan Productions to provide safe parking program here in the city of Seaside. That's currently happening. The meal on Thursday is currently happening. Specifically speaking, due to everything that has taken place in our world right now with this virus, we feed a hot meal every Tuesday, provide a food bag every Tuesday, every Thursday, and every Saturday. We previously, on Tuesdays, before this took place, our numbers were maybe 30 to 50 bags a week. It has now grown to 258 food bags per week, and we feed 450 hot meals per week between the Tuesday, Thursday, and Saturday. We are in the process of, for the homeless specifically, beginning a BMBC wash house, which is, we are going to provide 2 washer and dryers in a certain section in the back part of our church, which will enable those that are in need to do so through a signed up type of regimen and program to be able to wash their clothes, which gives them a more homely, safer environment than a washateria. That is something that is coming in the near future. Also in the near future, we have a BMBC HH ministry, which is Homeless to Hopeful. And this ministry focuses on homeless individuals and those that per se are not homeless, but those just have had an episode in life that it's struggling right now for job search, hygiene, education. So that's just a small, I guess, snippet of what we are doing now. Again, thank you, Steve, for allowing me to be in on the call. I'll mention what we provide right now. We are providing some educational components as far as paper and some electronical stuff. We have a couple of computers that we're providing for some of the children that are not able to have these electronic things, since they are a shelter in place in school and the transition of school has changed. I would say, what would we need? Financial help is always needed, because the church is, we are pretty much pushing out what is needed as far as the food that we're providing. Volunteers, our members are volunteering. Any canned goods, beans, rice, those types of things that the pantry provides, that Dorothy's Kitchen. I know the Valley Mission. I know from Jeff, I work close with him, Valley Mission. So the same things that they're providing, that they may need help with, we're providing, and we would love to have help as well. So that's pretty much all I can add at this point. Thank you, Steve.
Got it. Yeah, you bet. And I do have a flyer I'll put up that lists those needs, so that people that are here watching or listening in on this call about homelessness and social services and COVID-19. I did want to transition into a Q&A piece. I've got several Q&A questions that have come up, and the first that I have is Jill Allen. If Jill is available to respond, I know she may. Jill, are you there? And if not, we can come back to her, because I did want to. Okay, go ahead, Jill, and I'll put up what Bethel Missionary Baptist Church had for their list of needs. But Jill, maybe you could comment on the growth of the homeless population. I know you've seen it grow over the last number of years, certainly since realignment, and with COVID-19 and the projected unemployment that the Assemblyman shared with us at 25%, new and speed. What is your prediction for what the needs are? And who's on this call, the players. How do you see it playing out, and how do we best be prepared? Maybe you could start there.
Well, I can say that, here's my prediction. We'd better all be ready for it. and I can also say that I'm probably not the expert locally in terms of people that are situationally or newly homeless. There are other people here on the call that can speak better to that than I can. But what we do see are people that will end up in Chinatown because there are not adequate safety net services for them to be caught anywhere else. And once they're in an environment, in a large encampment where chronic unshelteredness is the norm, they quickly sink into a lifestyle. They have to cooperate with the street economy and other factors that will keep them chronically unsheltered for a long time. The best thing that we can do is be prepared as a community with a safety net to catch these people before they become another chronically unsheltered statistic.
Did we lose Jill there?
No, I'm here.
We might have.
I know.
Okay, sorry.
I'm sorry, my internet connection here might be a little doubtful. Is everybody hearing me okay?
Yes, we can hear you.
Okay, good. Jill, were you done, or did you have a little more?
No, I'm done.
Okay.
I'd love to hear from some of the other people on the call, in reply to that same question.
Okay. Okay, so next on my list, I had Gloria De La Rosa. And again, back to some of the advice that you'd have as a nurse. You kind of
How come I'm
tell
losing
us,
you?
Councilwoman.
Yeah, am I unmuted? No, I'm not muted.
You're unmuted. You're good. Maybe what you've seen about hand washing and hygiene and some of those things.
Well, we talk about it, when we go out to the encampments. We're doing education. We're doing outreach and education. And what I'm seeing in the encampments, because the demographics are really important, since I did work with surveillance to me. And I'll tell you, the age group that I'm seeing in a lot of these encampments are from 20 to 40. A lot of young men. And yes, we have women, but there's more males than women out in the encampments. And, they're asking us for basic needs stuff, like hygiene products and things like that. So as a team, under, working with the city, we're going to take care of those needs that they have. Yeah, we're working with them. We're listening to them. And like I said, the most important thing for me right now is making sure that they have access to healthcare and making sure that no one's sick. That when we go out there, is anyone coughing? Does anyone have a fever? We're asking those important questions.
Very helpful, and I appreciate that. I do want to go back to Teresa. On behalf of Community Homeless Solutions, given that there's a little transition going on with your leadership on the staff and stuff, but I'd love to hear about the shelter that you operate. I know you sent me some pictures of some of the trailers that arrived, so I'll bring those up on the screen, but can you speak to the trailers, how you're using them, and how prepared you are for COVID-19 should there be exposure or, let's just say someone comes down sick in this shelter. I mean, this is the only county city shelter that I know of. So maybe a few words there.
Sure. So our Salinas warming shelter was an overnight shelter, and overnight we became a 24/7 shelter. I think initially from many of our guests there, it was hard for them to accept the fact that this was a real thing. And we needed to tell them the facts. And so we actually did a presentation with a public health nurse from the visiting nurses and did some education, but we also are having them sign a contract that says this is what you need to do in order to be safe, and you can bring this back to the community. So we're only letting one person in a family leave at a time. Used to be they'd go out and stay out all day and then come back in, but they're only able to go out for a 2-hour period for essential needs or if they're going to work. We've had to start providing childcare in the warming shelter because those kids are there. Thanks to the Monterey County Office of Education, Dr. Donna Smith, we have Chromebooks for all those kids and hotspots for many of them. So they are able to do their homework and study. And we have part of our staff that are working with that also. That's happening up in Natividad too, because they are a shelter where a lot of the women work. And so the kids are doing their homework kind of in a 6-foot distance apart at tables, but they're doing what they need to do. And that's been a significant change of going from not having anything to do with education and now almost like a homeschooling center. The trailers themselves were state-owned, but now the city owns them. We have 5 that are at the Chinatown Navigation Center, and there are 3 that are at the Salinas Warming Shelter. We did open the Navigation Center to individuals that we were taking in on the 31st of March. And we also continue to provide showers and hygiene situation for those folks that are on the street. So kind of like Dorothy's does, we provide those things too. The trailers still need hookups for water, electricity, the sewer collection. So they're not operational yet. but they will be. And so the 3 that are at the warming shelter, we also need to fence that area because we don't have it as a secure area where the Chinatown Navigation Center is behind a bar, basically, of what they're doing. We have 5 units that are a 5-person trailer, and then we have 3 units that will hold up to 8. And some of the families that are in our warming shelter are crammed into what used to be a public defender's office. And there may be 6 to 7 people in that individual room. And you can imagine sheltering in place in that kind of a situation with your kids and with everybody else. So it's a challenge. It is. We have people that come out and eat as groups of families, and they're at different tables. But it's been a really big change in what we're doing. We thank the Salvation Army, Victory Mission on Faith Communities providing food to the warming shelter in Salinas. Our Natividad shelter used to be, they prepare all their own meals. And so they were getting food from the food bank, which, as we know, it's not there. So they're relying on more donations of food. Trader Joe's has stepped up, a couple other places have, but we're also seeking those individuals who would be willing to provide food. And that would be, we're going to put some of that on our website, what the specific needs are that help that situation. So that's a big part of what we're doing. We are screening our people that come in and out of the shelter with the temperature and asking them the COVID-19 questions. So anytime you go out and come back in, you're going to get screened. And so that's one of the ways that we're trying to keep the people safe that are there, both our staff and our guests that are there.
Got it. And you're at capacity right now?
We actually, believe it or not, we had like 3 families that were able to find housing, which was a really wonderful thing. And so we are accepting, I think we maybe can house about another couple families. We also are maintaining 1 room for isolation. And you mentioned, what do you do if you have a problem? Well, we did. So we've already had that challenge. We had somebody that was symptomatic, went into the ER and had their testing done. We actually put that individual into one of the isolation rooms and started our procedure that we developed related to that. Fortunately, 48 hours later, her test came back negative, but you don't know during that period of time. And so you can't expose everyone else. So.
Wow. Well, very, very helpful to hear. Extremely helpful. And as you share the kind of picture as to needs and what you're facing, I think it's appropriate to now fold in, the faith community a little bit. I think it's important. I know as it relates to, certainly Bethel Missionary Baptists and the Baptist Ministers Association, whether it's Pastor Artis or Pastor Lusk, I know that there's been an interest in overnight parking of RVs and those sorts of things. Pastor Lusk, maybe you can comment on, how prepared your operation is for COVID-19. What sort of measures have you taken, and what are your concerns looking into the future as infections could become more evident?
First of all, I'll say that our safety measures are, as we do provide our meals and on our food bags every Tuesday, Thursday, and Saturday. The church is then sanitized and cleaned with a local company on Monday, Wednesdays, and Fridays, and then Sunday mornings, just in for our viral worship that we have, and the 1 or 2 people that are there attending with helping with social media. We right now, the expectation of what is to come, we're just preparing for what is right now because we really don't know what is to come. Every day that we do feed, I will say this, every individual is hand sanitized. They receive gloves. Those that request a mask, they do receive a mask. We do have a seating that we set out, pre-seating, which is 6 feet, sometimes 8 feet apart, but it is something that that process and procedure they do follow. When they do enter the building, they enter in through the back parking lot. We have our different teams set up to give them their food bag, which is a grocery bag. They proceed. We have markings on our floor, which arrows and 6 feet standing in distance. The front door, they come in the back and they go out the front. It's a pretty tight system. All of those that are volunteers that are here, they wear gloves, masks. We actually have 2 of my members are professional cooks, and they volunteer their time to cook the meals on Tuesdays and Saturdays. And then we partner with the Jewish Christian Muslim Alliance out of Carmel, which provides the meals on Thursdays. From a spiritual perspective, and I'm understanding both of the spiritual and the relative fact of what we face, but we try to, when those individuals that come with kids, we try to give them an atmosphere that is one of hope and regular feeling. Each child receives a goodie bag with the cereal and granola or a little 1 or 2 bites of candy, something that would just make them, when they leave and go through the doors, that they will feel some piece of normality, if I can say it that way. Steve, that's pretty much all I can share, because the work needs to be done, and we are doing the work. We do need help doing the work. As far as I can say, thanks to the city and the county, we are considered an essential entity within our city, because we are providing what we are providing. I had heard a mention from Dorothy's Kitchen. I would like to partner with a few of those that are on the phone just to see if there's anything that can be done collectively together, because there are some individuals in my church that would like to volunteer their time. So I don't know if that's something that we can work on. That's something that I hope we can. But as I said, Steve, that's pretty much all I have to add. If there's anything that I can answer specific that I missed, I'll be more than happy to do so.
No, and I think that's a good takeaway, Pastor. A clearinghouse or a means for volunteers that want to aid to some. That with me as well as it relates to his, and then that'll be something I'll note in the notes. You know, I don't know. It looks like maybe Roxanne, if you wanted to comment on that, perhaps.
Yes, this
There'd
is.
be something. You know,
Oh, I'm
yeah.
sorry. I am home and I have a ton of children. So
That's
please
okay.
excuse any chaos that you may hear in the background. But yeah, I do want to just say that the faith community in general has been a huge blessing to the service provider network. We've had Love Our Central Coast step up. They want to help. We have reached out to a couple of churches who have made donations to us directly, and we're using those donations to help our service providers in any way that we can. I wanted to let everyone know that on our website, we had put a form, a volunteer interest form, where we're starting to collect information of people who want to do exactly that. They want to help the homeless. They want to help the situation in any way they can. So if you do find people are interested, they can go through us and we could dispatch them to the appropriate organizations. Okay.
Very helpful. And if I may, I think at this point, I'll turn it back to Rob. From the perspective, you can comment more on what you anticipate as to need and how you're preparing or best prepared as an organization.
I'm sorry, my phone is cutting out. Was that directed towards me?
No, I was going to turn it back to Robin and have
perfect.
her,
Thank you.
Yeah, comment a bit. That's okay.
Sure. Well, at Community Human Services, we offer a lot of different modalities of service, if you will. So we went through program by program to ramp up for this, and in pretty short order, we retooled all of the programs so that we could continue to provide services. So just for example, at Off Main Clinic, we serve 233 adults who are dependent on opioids. We worked with other providers in the state to get exceptions to some pieces of legislation in Title 22 to get more take-home exceptions, which allows us to give people more medicines to take home so they don't have to come into the clinic daily, which reduced greatly the number of people that are coming into the clinic daily for medications. We purchased hand washing stations for both off-Main Clinic and also for our runaway and homeless youth program in Monterey. We did the same thing that other providers did. Where people are lining up, we provided, tape on the ground, demonstrating 6 feet apart how people should stand. We used some COVID-19 education materials provided by the Centers for Disease Control and other organizations like that to provide the kinds of education that our clients would need in terms of covering their sneezes and coughs, washing their hands frequently, using hand sanitizer when that wasn't possible, what the signs and symptoms were that they needed to look for, what to do if they thought that they had symptoms that were congruent with COVID-19. Over at our Runaway and Homeless Youth Program, we had to discontinue drop-in hours, which were held daily, to avoid large numbers of kids in the building at the same time. So we're doing we have a nice driveway. So we've set up our outreach to be like a driveway drop-by area with tables and tents, and the kids can come get the exact same things that they were getting previously, which is all the kinds of basic needs like socks and underwear, hygiene products, first aid products, again, COVID education, hand sanitizers. And we're starting to get masks now so we can distribute masks as well. Our shelter is still open, so homeless youth have a place to go in the evening in Monterey. That's for kids 18 to 24. I do want to connect with you, Gloria, if you're seeing 20-year-olds and up to 40-year-olds in Chinatown. Our Salinas Valley Street Outreach Program should be working with you, or at least coordinating with you, so that we can provide some resources to that kind of 18 to 24-year-old age group, which is what we can do with the grant money that provides those services. But we went through even our services that don't have to be provided face-to-face and made them all telehealth services. So we're still providing outpatient mental health services. And via telehealth, we're providing outpatient drug treatment services via telehealth. And we're still accepting new clients in both of those programs. Unfortunately, we're seeing a great increase in the demand for mental health services and for drug treatment or substance abuse services. Our residential drug treatment services at Genesis, obviously we can't make telehealth. So those are still face-to-face services. But through the process of attrition, we are down to about 2/3 the regular capacity, which allows us to space people out and provide the social distancing that's needed and create some isolation areas for people either who become symptomatic and we need to observe them until tests come back, or another separate isolation area for new intake so we can continue to take new people into treatment, isolate them for 14 days to make sure that they don't develop symptoms before they re-enter or before they enter the general population in the treatment program. So we've gone through program by program, and I'm not listing all of them, but you can see we have quite a variety, and each program took my staff, they needed to be creative, they needed to be innovative, and they needed to find specific solutions for each one of those different program areas. What I see in the future is a great demand for services. I think, in our parenting education program, we're still providing parents with telehealth support. They are really appreciating it. They're finding it very difficult to be off of work, at home with kids, providing education to kids, sometimes working from home and providing education to their children. And just the stresses of everybody being in the home for long periods of time, they're really finding it difficult to be the kinds of parents that they would like to be and to be there for their kids in the way they'd like to be there for their kids. We discontinued our domestic violence groups, but this week we're working on bringing those back so that we can do those via some sort of meeting like this, a Zoom meeting or something like that, so we can continue to do the domestic violence groups. I know we've talked to our partners at social services, and they're experiencing an increase in CPS reports. And so we're still getting those referrals in our Pathways to Safety program. So we're directing resources to parents and to families that are experiencing a great deal of stress right now. And I just think that substance abuse will continue to, the demand for substance abuse services will continue to increase, for mental health services, for parenting services, for domestic violence services, and for homeless youth services, which is the homeless component of our programs. But I did, if I could, would like to talk about in the little farther future, the shelter that we're developing on the peninsula in partnership with our great partners, the Gathering for Women. So, you know, this whole, I think Jill called it like an attack by this virus on our community. This whole situation underscores the very importance of having shelters for people to go to so that they're off the streets. They're not continuing to be subjected to the elements and in the environment, and they can stay as safe as possible during times like this. And, you know, to that end, we're trying to develop the a homeless shelter for single women and families with children on the Monterey Peninsula. So we're partnering with Gathering for Women. They'll help serve and provide case management to the women. Community Human Services will provide those same services to families, and then Community Human Services will operate the actual shelter. And, you know, the city of Salinas, or excuse me, Seaside is partnering with us. The county is partnering. They're offering the modular building that we're rehabilitating, and we haven't stopped for a minute. So we accepted the low bid. We are getting into contract with the contractor. It's Thayer Construction in Seaside. And we hope to break ground by the beginning of May. We want to do a groundbreaking, but it's probably not appropriate. So we may do something virtual. But it is a big thing to celebrate in the community, and we want to mark that with some sort of groundbreaking commemoration or ceremony. And once we're done, we hope that the shelter will be completed by the fall of this year. We will be able to serve approximately 30 people. And I say approximately because it really depends on the number of people in each family unit. So we'll serve approximately half single women and half families.
Wow, thank you for that update. Couple of things. And that is, there was a question for Teresa, maybe you can speak, or maybe Roxanne, as to the governor's allocation of hotel rooms for homeless that need. I'll start with Teresa, and maybe Roxanne can chime in, or maybe Roxanne, if you want to speak to that.
Well, as far as I know at this point in time, and it's, you know, I've been on all the calls with the county too, that we actually don't have anything specifically allocated that we can access. But Roxanne, maybe you know more about that.
So yes, the county has been working with quite a few partners to try to get hotel room key, project room key up and running. And it does appear like they have acquired the motel rooms, and they're going to be moving forward, and we'll be able to get people possibly in starting on Friday. It is quite complicated. So when you think about the needs of people, you don't want to just drop them off and leave them alone. You want to make sure that we're providing, the collectively, not the coalition, but everyone is able to provide the services that is needed to give them the things that they need to survive while they're in those motel rooms. There's the tiniest little details, right? So it's like, if they have a dog, can the motel take the dog? And if they do have the dog, does the dog have fleas? It's like the smallest little details the county has to work through. And I by no means am a representative of the county, but I can say with confidence that they have been working around the clock to try to get Project Room Key up and running. And we'll start seeing the fruits of that labor very, very soon.
Got it. Thank you. Thank you for that. And we are joined by Melissa Kendrick from the Food Bank for Monterey County. And I do want her to give a bit of an overview as to what she's got going on. And then, Melissa, there's been the question as to how does the food bank respond and how prepared are you for COVID-19?
Well, we have completely reimagined the way we do everything. We can no longer have, obviously, all of our sites before were walk-up sites. We've completely had to redo those. We used to rely on over 500 volunteers a month. We can't use any volunteers now. And all of our drive-throughs, all of our distributions now have to be drive-through. Many of them are serving in excess. We had 2 in South County today that had over 750 cars at each one. So
Wow.
we have over 30 new sites that are specifically in response to COVID-19. We also have several sites at schools. I think we have 24 school sites. We are in every part of the county. We have weekly distributions, large scale, like I said, most of them in excess of 600 people, starting in San Ardo and going all the way up to Pajaro, and then in Castroville and going all the way down the peninsula. So it's been a logistical challenge, but we've definitely done that. I think you all know we have the National Guard working with us. We absolutely could not do this without them, but we only have 35 of them, and then we have the 26 staff members. So we're kind of working around the clock. I think our biggest challenge right now is just finding the funds for food. I think you all know that we got $250,000 approved from the county, but that's essentially going to last for 8 days. So we are serving quadruple. The numbers are just, honestly, the magnitude is something I never expected. We're serving at this point like 55% of the county. Hoping that once shelter in place is relinquished, that perhaps we'll see some of those numbers go down. But the reality of it is that our numbers reflect exactly what's going on with unemployment. I don't know if many of you knew, but even before this, we were well above unemployment for California. Our county was running at around 10%. When everyone else was about 4%. So we were already much higher. Now, I think you all know, I mean, many of you hail from the peninsula. If you just look at Cannery Row and just, I mean, the decimation is incredible. I think you also know that we have the highest non-citizen population here. So over 22% of the county are non-citizens. That creates other challenges just because even if and when there is, you know, some response to COVID-19, they will not be getting any of those funds. And so, like I said, everybody at this point is turning to the food bank to provide food. And we are just doing everything we can to address that situation. But like I said, at this point, our biggest challenge are just the funds, you know, just for the staples that we purchase. Think like pinto beans have gone up 69% since last month alone. Yeah, and we've just done, it is unbelievable. So what we could have purchased last month is now costing us 50 to 89% more than it did, and it keeps going up, and that's if we can get it here. The lead times to get food into the county now are about 6 weeks, and that's, you know, some products eight weeks. So that's where we're really hurt. When we went into this, we had 6 months worth of food for this particular program that we're doing, and we have completely depleted that within 3 weeks.
Got it. Got it. I know I want to make sure we end on time. We have just another 4 or 5. Roxanne, if that's possible, and that's the role of the federal government in this. Are they paying for the hotel rooms? And then what you know about testing that is to aid in so testing and any role the federal government's got.
I really can't speak to testing. That is the kind of big question mark right now, I think, for all sectors. But I can say that the federal government has stepped up. They have increased their emergency solutions grants allocations. Locally, the city of Salinas is the ESG recipient. They've also increased their CDBG allocations to CDBG recipients. So locally, on a federal level, we would see over maybe $1.5–2 million extra dollars coming from the federal government down those funding streams. I can say also that the governor is just like a rock star in all of this. The state of California is kind of where the action's at. The state has been sending down trailers, as Teresa talked about earlier. The city of Salinas was able to get 8 trailers, and then the county of Monterey requested and was approved 100. We received our first 15, and we're in the process, not we, the collective we, we're in the process of trying to figure out how to get the remaining 85. Those trailers, I'm sorry, I'm on the phone. Those trailers are for homeless individuals, and they are for the counties to keep. So the wonderful thing about this is that after COVID-19, the county will have, hopefully all 100 trailers to serve the homeless and continue doing some sort of services for them, possibly exploring like transitional housing or things of that sort. So all of those things are in the works. The federal government has announced other funding streams, but from what I understand, a lot of those are kind of on hold because they weren't COVID related, and much of that money was redirected to the CARES Act.
Got it. Well, thank you, Roxanne. I know we're out of time here. There were some great questions and some good discussion via Facebook. I hope this has been a valuable talk as to, again, homelessness and social services and COVID-19. There will be future broadcasts, and so stay tuned. And some of the takeaways, the need to partner volunteers and interest with agencies. So Roxanne, I look forward to following up there. There was some great insights from the faith community. The importance of testing, that's come up again and again and again, and specific for homeless, how we can get in touch with either state, county, or even private labs to aid in that capacity. PPE resources. So, again, to those watching, to those that commented, we will record this, we'll repost it. And I just want to say thank you to everybody that participated today. I hope there was some good value and a better understanding as to what we're facing in this county and as it relates to homelessness in the wake of this pandemic that's gotten more challenging. So I'll sign off now, and again, just say thank you to everybody for joining today, and look forward to continuing to work with you. All right. Have a good evening.